Hello there, I'm Nidhi Gupta, I'm one of the doctors.
Phil Davies, my dad Stan is here. Well, what do I say? I'm unhappy. I'm sorry to say. My dad came in, he had pneumonia. He's an elderly chap, but he's normally fit and well. Does his bowling and his clubs and everything. For his age, he's remarkable. But he got chest infection, turns to pneumonia. He comes in here. I come and see him, and he's worse than he was. Apparently, he's picked up some sort of bug, and now he's got diarrhea and God knows what else. I mean, you're meant to get to hospital to get better, not get something else. I mean, are you going to prevent that sort of thing happening? I mean,
well, if it's okay, I'm really sorry what's happened to your father. It's not good what's happened to your father.
You're right.
If it's okay with you, though, if I can take a couple of steps back and if I can kind of explain the situation as to what's been happening. So as you rightly say, he came in with a pneumonia. And the difference between a chest infection and pneumonia is whether we can see it on an X-ray. That's in terms of technical, that's the technical definition. Okay, yeah, if you can see it on an X-ray, it becomes pneumonia. Yeah. If you can't see it on an X-ray, it means it's a chest infection. So we could see that there was an infection on the X-ray, meaning it's a pneumonia, and we gave him antibiotics. And unfortunately, he's got something called Clostridium difficile, which is the name of the diarrhea. Now, I'll kind of take a bit of a step back here again, and I'll kind of explain, if it's okay, in a bit of a kind of a metaphor. So in our bowel walls, in all of our bowels, we have millions of bacteria. And those are good bacteria. We need them.
They're meant to be there.
They're meant to be there. Okay. They help us digest our food, and they protect against invading bad bacteria that we might ingest through. Sometimes it works, sometimes it doesn't work, like when you go on holiday and get kind of a tummy bug. But most of the time, the good bacteria in our gut, which we have to have, is very good at protecting our bodies from other bugs that might come in and cause us disease. Antibiotics, when we give antibiotics to treat an infection, we've been giving it in your father as an injection, intravenously. Yeah. The antibiotics, they don't care which bacteria they kill, in terms of they don't know that the bad bacteria are in the lung and that there's good bacteria in the gut. But antibiotics, they just kill all the bacteria they can find, because they get spread all around the body in the bloodstream. And unfortunately, we don't have a method to target a specific part of the body. So for example, in your father, the lungs, and protect the gut. We don't have the ability yet to give an antibiotic that only goes to the lung and doesn't go to the gut. So what's happened is that the antibiotics, whilst treating the bacteria that's caused the pneumonia in the lung, has also killed some of the good bacteria in the gut. As a result of that, the bug called Clostridium difficile has been able to attack the gut. It's not been protected against.
How does it get there?
So it's going to sound a bit disgusting, and I do apologise. It's fecal orally, basically. So contamination, hands not being washed, and then somehow that's gotten in. And that's how most gut kind of infections.
Are you talking about my dad's hand or nurse's hands? Or?
So I'll go into that in a second. Yeah. I can't tell you right now how it happened, but I will go into it in a few moments about kind of how we do find out, if that makes sense, okay? Yeah. So I'm just going to put that to one side, but I'm not going to ignore it. I will address it in a moment.
So you do investigate to find out how it's happened?
Absolutely, absolutely. And if it's okay, I'll just go back into the diarrhea, and then I'll go into the investigation.
Okay. Yeah, fine.
So unfortunately, that's what's happened to your father, is that because some of that good protective bacteria have gone, this bug has been allowed to cause an infection in your father. And it may sound counterintuitive, but we have to give another antibiotic to kill the second bug, this Clostridium difficile.
Right.
While still trying to treat the pneumonia as well. And we're going to change the antibiotic that was treating his lung to one that has less likelihood of causing further gut problems. Does that make sense?
Yeah, to a layman, sort of, yeah. I get the general drift, yeah.
So it's been incredibly unfortunate that your father has got this, and I can only say sorry about that. we are required by NHS England to report every case of Clostridium difficile. And we have to do something called a root cause analysis. And that is a very lengthy, kind of like 10, 12 pages worth of investigation we have to complete. And we look at all the potential causes as to why your father has got this infection. Can we identify where was it that he got it from? Was it that there's another patient on another ward that got it and then a nurse brought it along and then didn't wash their hands, or some other reason? So we need to do that investigation, and that will be sent up the line to NHS England. But also we are more than happy to give you a summary of that investigation, your father and yourself, to help you understand about why this happened. And so you can understand also, because we want to learn from it to prevent it happening again. And that's really important. It's not just to make sure your father's okay, but to try and look at if there's ways that we can prevent it happening again.
Well, I mean, I wouldn't understand all the medical details, but my main concern...
We can do a layman's kind of summary of it.
I want my dad well and home. Of
course.
And obviously don't want anyone else to get it. But you say you're investigating that and you do things to make it better and,
absolutely,
if necessary, retrain or whatever.
And it's also important to make sure your dad gets better, to give him the right treatment, to make sure he doesn't get dehydrated from all of the diarrhea. So we give him fluids as well to maintain his hydration. But also, I'm sure you've noticed that he's deteriorated quite a bit on the ward because of this.
He's weaker.
Yeah,
he's weaker than before he came on. We said he was unwell when he came in, but he's weaker, which, I mean, what's the sort of scenario from now on? I mean, do we have any idea of how long he's going to be here? And when he comes home, is he going to need, I don't know, wheelchair, medication?
Well, our aim is to get him home and to get him home well, but the recovery process is going to be weeks to months because, one, of his age and as well as the fact that he's had these infections. So he's what we call deconditioned because he's not been using his muscles as much, he's not been moving around as much, and it's a slow recovery. What we need to do is we need to get over the diarrhea, get that stopped, get him well from the point of pneumonia. We will start getting the physios and the occupational therapists to come and see him and assess what his status is and what help does he need to get back up to where he was.
Right.
And then they will make the recommendations. Is rehabilitation, like a middle place between here and home appropriate, or is it that he can do rehab at home with people coming in?
So it might be a different ward or something.
There are units that are designed for somebody like your father who needs extra support to build up their strength again, get them back on their feet. They might not be quite ready to go home because they need a bit more strength building, but by having that kind of going to a place where they can get that bit more extra input that we can give, then it gets them to home.
Oh, he's very independent, he's very independent-minded.
I mean, he won't be able to go to that unit whilst he's got active diarrhea. So he needs to be free from the diarrhea because we don't want him to spread it to anyone else, of course. So that's why I said we have to get on top of the diarrhea and make sure he's well from the pneumonia because we don't want to send him to a rehabilitation place if he's still medically unwell.
You might give it to somebody else.
Exactly.
Did you have any idea of timescale at all?
So normally most people get over the diarrhea with the medications within a few days. I can't predict in advance who is going to get better and who isn't over what period of time. I can just tell you that over populations it takes a few days. But there are second line, third line, fourth line treatments we can give to people who don't respond to the initial treatment. But we're going to give the initial treatment and see how that goes, monitor his bowel motions, and then continue to monitor him on a daily basis. And then we'll start getting the physios and occupational therapists in after that.
And it might be rehab in a ward or maybe at home.
Depending on the assessments that are done.
He lives independently, but...
If he needs a bit of extra support whilst he's recovering...
He could stay with us, I mean...
So I think what we'll do, I'll get the physios and the occupational therapists to assess him with you present, so you can give information about what you're able to support with, and then that will help us build a package as to, you know, what's the best way to discharge him. But I do think it's important to get on top of the diarrhea and the pneumonia, and also just as something just to say, if you want to put a complaint into our PALS, the Patient Advisory Liaison Service.
I'm still half-minded to put in a formal complaint.
It's not a problem. I can give you the leaflet and the information for that.
Okay.
And I mean, we'll give you the information about the investigation irrespective.
Okay.
But if you want to put a formal complaint in, that's not a problem, and I can give you that information.
I'll speak with him and see what he wants to do.
Any other questions or concerns or anything else you'd like to ask me?
You'll contact me, will you, when we get the assessment for rehab and stuff like that?
Absolutely, absolutely. Okay, so I'll get on to that, and then we'll go from there.
Well, it's a bit of progress.
Okay, all right, take care. Thank
you.
you.
Doctor. Thank you.